Hello, everybody. Happy Monday. Welcome to another episode of Learn with Flo. Super excited to continue our conversation and series this week. Last week, I talked all things bloating, and you guys just went off, which I'm not surprised because bloating is the number one symptom that I see in private practice with individuals coming to work with me. I would say bloating is very, very common, not just females, but also males. And so last week, if you were with us, we really talked about what is bloating exactly and why is things like elimination diets, cutting out gluten, cutting out dairy. It's not always this magic pill that we're promised that it's going to be. And a lot of times we do all of the right things on paper and still end up feeling chronically bloated. So what's all that about, right? And what we got to really dive into last week was talking about the state of the gut in general is really what is going to be driving certain food responses and food reactions. So we have kind of a misunderstanding in the world of even functional medicine, even your wellness influencers who are trying to kind of blame the food. And I am here to really stop that trend in its tracks, more so because it's incredibly inaccurate, but also because it can lead us down a very slippery slope of disordered eating patterns, food anxieties, and that doesn't bode well much for the brain-gut axis when we look at overall gut treatment and overall gut restoration. So we can't have increased food anxieties and food anxiousness because we're trying to sit here thinking it's going to be about the foods. It's not going to be about the foods. It's going to be about the state of the gut that is receiving said foods. So if you were with us last week and you heard our bloating conversation, then it will be a perfect segue into today's conversation where I want to peel back the veil on a very common diagnosis, actually the number one most common gastroenterologist diagnosis, which is irritable bowel syndrome, very often known to us as IBS. Now, there's different types of IBS. Some people get diagnosed more with IBS-D, IBS more in the loose stools or diarrhea front, or IBS-C, which is more of the constipation patterns. Now, you can fluctuate between both as well, too, so there's not a tried and true pattern, but more often than not, when you get more of the diagnosis of irritable bowel syndrome, it can feel validating to kind of understand like, wow, somebody sees me, someone understands my struggles. But also we have to understand that IBS is actually not a diagnosis. It's really actually kind of a catch-all term that we just use to cluster together certain symptoms. And essentially it's a gastroenterologist or a primary care physician that's essentially just saying like, here, I'm going to lump all these symptoms together. We call it a syndrome. We call it irritable bowel syndrome. And essentially it's like, I don't know why you're struggling the way that you are, but here's a syndrome title, right? And so more often than not, there's kind of more Band-Aid solutions that are handed because we're just throwing stuff at a wall to see what sticks at that point from a conventional medicine standpoint, or at anything, we're just trying to give you some like Band-Aid solutions so that you don't feel quite as terrible. But none of those solutions are actually geared towards correcting the underlying issue that is irritable bowel syndrome. So today, I really want to talk about how maybe a little bit more of a controversial opinion, but a very accurate one according to what I have seen in practice as well too, is IBS isn't actually a diagnosis. It is a catch-all and it is a cop-out because honestly, being told that you just have IBS, like I said, is really the medical version of saying we don't know what's wrong, but we're going to slap a label on it so that it looks like we did something here, right? We can put something in your chart. We have an actual label to be able to then prescribe some sort of pharmaceutical interventions for you. So irritable bowel syndrome, that is not an answer. That's not a treatment plan. That is merely a description of what you are struggling with. So it's a blanket term that lumps together bloating, which we talked about last week, constipation, diarrhea, bowel urgency, abdominal cramping, and gas, right? Any one or a cluster of those symptoms turns into one very vague label that no one tells you anything about why it's actually happening, right? And worse, once you get that label from more of a conventional medicine standpoint, the conversation usually stops. Right? It's like, oh, you just have irritable bowel syndrome and you get sent on your way, right? Maybe you're handed like a handout for here's a low FODMAP diet protocol, which again, an elimination diet, which we talked about last week, not really fixing anything. It's just a Band-Aid solution. So you get handed a low FODMAP printout, or maybe you get handed a prescription for a laxative or a antispasmodic agent, or you're told to just reduce your stress. And then you're sent on your way as if like managing all of these symptoms now becomes your new full-time job. right? So if you've ever been through that situation and you're left thinking like, is that it? Like, am I just stuck with this label forever? And like your mind starts to wander a little bit and you're like, is this my new normal now? It's like, let me tell you right now, you are not crazy. You are not woo-woo. You are not high maintenance for wanting more actual answers to why you're struggling the way that you are. And you're not being dramatic for believing that your body actually deserves more and actually deserves better answers. Okay. So let's talk about and at least set the stage for what IBS actually is, because like we said, it's really just kind of this medical catch-all cop-out for a description of different symptoms of like, we don't really know what's happening to you. But let me tell you what IBS really is. These cluster of symptoms, let's break it down a little bit more scientifically, because understanding your body is really where you start to get your power back as a patient, okay? IBS isn't a disease. This is a syndrome, right? Which just means it's a cluster of symptoms that we put together just to put a nice little bow and a nice little label in your metabolic chart. All syndromes are just a collection of different symptoms. They're not root causes. And we know that symptoms to me are just messengers. They're just communication signals from the body. They're trying to say, hey, something's off in this terrain in here. Could you listen a little bit? Could you throw a bone my way, right? When you just kind of mute those messengers without asking why they're speaking up in the first place, you're going to miss the opportunity to actually correct what's wrong. And that's what my biggest passion point is let's take this IBS diagnosis, let's peel back the wallpaper a little bit, and let's look at what's actually hiding behind this cluster of symptoms and this label that you're just supposed to wear forever and eat this restrictive low FODMAP diet, right? What many people with IBS don't know is what's really going on underneath the surface. And it could be a cluster of different things. There's not one catch-all for all people, but there's a lot more of a complex understanding of what's really going on in IBS. And I guarantee you that a low FODMAP diet is not going to fix it. And also no amount of probiotics, fiber, laxatives, antispasmodic agents in the world is going to also fix it. Right? It's like those are just symptom managers or symptom relieving tools, but they're in no way, shape, or form kind of like correcting the terrain in the first place, right? So let's really walk through some of the potential things that in my practice, I actually see IBS actually being when we do a little bit further digging and a little bit further testing. Number one being small intestinal bacterial overgrowth. Sometimes you'll hear this called SIBO. About 70% of IBS cases are actually SIBO. And SIBO is completely reversible, it's completely correctable, and it's because of what happens in that SIBO picture is we get digestive capacity issues, so we get low stomach acid or we have poor bile flow, and because of that we're getting food that doesn't digest well in the stomach, and then it gets passed to the small intestine where it actually like ferments and putrefies in the small intestine, and we get this bacterial overgrowth. Also, we can get that same bacterial overgrowth if we're chronically constipated and fecal matter actually like backs up from the small intestine. I know it sounds kind of gross, but it actually happens. So all of a sudden we get bacteria in the small intestine where we shouldn't have bacteria. So you get a lot of bloat, you get a lot of gas, you get a lot of reactions to all sorts of foods. You get a lot of IBS, or you get a lot of diarrhea or constipation, or kind of these big swings between the two, right? So it's reported that upwards of 70 to 75% of people that are told they have IBS actually have SIBO. And they weren't treated for SIBO, they weren't tested for SIBO, and SIBO also isn't one of those things that when conventional medicine tests for SIBO, they're going to test for SIBO and be like, oh, you're positive for SIBO, here's some antibiotics. That SIBO is just going to come right back because you didn't actually fix the terrain in which the SIBO occurred in the first place, right? So this is more than just small intestinal bacterial overgrowth. This is more than just IBS. This is like dysfunction in your migrating motor complex that we're going to need to sort out. Maybe you have some low stomach acid issues. Maybe you have some poor bile flow issues. Maybe we have these low-grade stealth infections that are going on in the gut, because guess what? If you have SIBO, a lot of times you also might have a yeast or a candida overgrowth. You might also have some other opportunistic overgrowths going on as well too, right? So when I see an IBS picture, this is not a forever label. This is not something that you have to wear across like a badge of honor and be like, well, I guess I just joined the IBS warriors. It's not just IBS, right? This is a whole underlying like messengers from your body trying to communicate these symptoms of like, hey, listen up down here because we have some issues going on. And if we don't get the opportunity to actually listen to those messengers and we're just really quick to shut them off with, like I said, low FODMAP diet, random probiotics, random prebiotics, just like I said, random constipation fixers or diarrhea fixers. It's like you're not addressing the true root cause problem and you're going to continue to have then downstream issues, right? This is not like a scare tactic or anything like that, but we have to recognize that when there is microbiome imbalances that go undetected and go uncorrected, this is where people down the road like, oh, I'm diagnosed with colorectal cancer. It's like, I'm diagnosed with Crohn's, I'm diagnosed with diverticulitis, I'm diagnosed with irritable bowel disease. It's like, those are the things that happen when individuals don't listen to those early stage chemical messengers. They're told they just have IBS and they just go on living their life with like a low FODMAP diet and maybe a laxative when they need it, right? It's like, you're not fixing the issue and it's going to just come back down the road and probably become a bigger issue than it is now, okay? So not even just like the physical load of experiencing all those symptoms, because let's be real, like waking up chronically bloated, being sensitive to 1,000,001 different foods, not feeling like you can comfortably like eat outside the home or even like button your pants, right? Or not knowing where the next bathroom situation is. It's like, that is a huge physical toll, but also think about the emotional toll of that, right? Where these people have gone from doctor to doctor, they're poked, they're prodded, they're scraped, they're just kind of shrugged at, right? And it's like, you're told to try the elimination diet, take this probiotic, cut out every single offensive food. And if you still feel bloated, then like you start to doubt this, like yourself, right? It's like, no, this isn't yourself. That's the issue here. This is the system that is currently established that's not helping you actually identify the root cause of your problem. Right. And they're more than willing to just let you like internalize the belief that maybe this is just who I am now. Maybe I just have IBS and we're looking for these IBS support groups. And it's like, oh, this is just part of our identity now. And it's like, I think it's great to identify with some, like I said, communities and like-minded individuals, but also people, it's like, your body's just asking you to take a deeper look here. Like, this is a reversible condition. This is not something that you're just like wear like a badge of honor forever. So it's who you've become or who you've had to become by living in a body that hasn't been understood. Okay. You haven't been given the resources to take a deeper look. So IBS is not the end of your story. It's actually the beginning of your story because it's the part where the system like stopped reading your story. But me and here at the Lowdown Methods and why I have created the system that I have is because like I'm going to keep turning the pages. Like IBS, like that's not the whole book. Right? That is like literally just a little clinical clue for me of like, oh, that's interesting. We need to dig deeper then because there's something that the body's trying to tell us. So for all of my IBS warriors out there, let me talk a little bit about something that I know a lot of you have all tried and I've made a quick mention of it, but the low FODMAP diet. If you're not familiar with the low FODMAP diet, it is a very common, very restrictive diet given to individuals that are diagnosed with IBS. Does it help with symptom management? Yes, it does, because it removes those foods that are easily fermented in the upper part of the small intestine, causing a lot of those bloating and gas kind of symptoms, right? So at first you start the low FODMAP diet and you're like, oh my gosh, this is amazing. I feel so much better. My bloating is gone. But it's like, it's really just kind of like toxic avoidance, right? It's like, oh, but the second you try to eat those foods again, you're going to have all of the same problems. It's like, oh, so it's my gut, it's not the food, right? It's like one of the first things that a lot of people are handed when they have an IBS diagnosis is this low FODMAP diet. And so just know that it can offer short-term symptom relief, but let me be very, very clear. It is not fixing anything. It's not fixing the problem. If you have small intestinal bacterial overgrowth, a low FODMAP diet's not going to do anything for it, right? If you have low stomach acid, poor bile flow, if you have chronic, like I said, chronic constipation that's backing up into the small intestine. Maybe you're in an environment that's exposed to toxin burden or mycotoxins. Like, the reasons why you have IBS are not going to be corrected by a low FODMAP diet. Just want to put it out there just so that people aren't like duped into thinking that's your treatment plan. That's not a treatment plan. That's like symptom management. Like, that gastroenterologist should hand you a low FODMAP pamphlet and then tell you to go make an appointment with me, right? So that you can actually get the answers of like, you have IBS, here's a low FODMAP diet. This will probably help you feel better for a little bit, but you really need to go make an appointment with the lowdown, because she's going to help you actually get to the underlying part of what's going on here, right? And that is how medicine should work. It should be a very integrative approach and an integrative strategy. And it doesn't happen all the time, but I digress. So just know that the low FODMAP will temporarily reduce some of those like gas producing fuel sources for the microbes, but it doesn't rebalance the microbiome. It's not going to restore your motility or your migrating motor complex. It sure as heck isn't going to rebuild stomach acid or bile flow or enzyme production. And it's not going to do anything to touch the emotional or the neurological stressors that, got us here in the first place, right? So not only does it a long-term low FODMAP diet, I'm not a fan of it, because I've seen it lead to a lot of nutrient depletions. I've seen it lead to a lot of decimated good beneficial bacteria. Like, your good bacteria like plummets, because a low FODMAP diet is also a very low fiber diet, right? It's because the fiber rich foods that are probably going to ferment earlier on in the gut. So, and like I said, it chips away at our relationship with your body and chips away at your relationship with food, makes food feel like it's the enemy. And I'm just not all about that, right? At the lowdown, we believe like you were not meant to live that way. You deserve freedom around food, not fear around food. So if the low FODMAP's not it, how do we move forward? We start by asking better questions is how we move forward. Okay. So instead of asking like, how do I manage these symptoms? We start asking, what's causing this? This is interesting. What's disrupting the terrain? What systems aren't functioning optimally here? And this is where the real work begins. It's not just slapping on another restrictive protocol. It's by understanding how your body digests, how it detoxes, how it defends you, and how it communicates with you, okay? So this is exactly what we do inside my Renew Your Gut program. I built this program with a passion and a purpose for a reason, because I saw such a hole from that transition of more of a conventional medicine to a functional medicine. And I'm like, even functional medicine isn't doing this right. They're just handing people these more restrictive plans and more kill protocols. I'm like, they can get that from conventional medicine. I was like, I am here to help them understand like what is going on at the dysfunction as a whole, and to make sure that this never comes back again, right? So this isn't just a short-term treatment. This is like, okay, how is this contributing to the body as a whole moving forward? So looking at, like I said, my Renew Your Gut program, you're going to actually get access to resources that you haven't been given before. We're going to look at using functional GI map stool testing to look at your microbiome. What about the bacteria? What about the viruses? What about parasitic overload? What about inflammation in the gut? What about your enzyme output? What about your bile sufficiency? What about your immune system is going on, right? Real insight to how your terrain is functioning. And then from there, we're going to personalize that roadmap going forward. We're going to think, how are we getting that one-on-one coaching, that customized support, along with content and online library of resources for you, just a full strategy from start to finish to really restore your gut, not just try to put some more Band-Aids on it, right? So these are the types of testing that, like I said, your GI doctor isn't ordering for you. This is what the elimination diet is not solving for you. And this is where your symptom relief actually becomes sustainable change. Okay. So if this is something you're interested in, if this episode hit home, if you're like, I'm an IBS warrior, Lauryn, nobody's given me more answers beyond just like, you have IBS and here's a low FODMAP diet and some prescription medications that you're going to be on for the rest of your life, know that there are answers out there. You can click the link in my bio. It'll take you right to my website where you can check out my Renew Your Gut program and register today. So I'm really excited for you guys to be able to have some other options besides just you have IBS, because I promise there's more answers out there than you've been given. So enjoy this conversation. Send it to a loved one that you know also struggles, and we'll see you guys next week.